Province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout.
Hello and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer, Dr. Jennifer Russell, and Premier Blaine Higgs.
Dr. Russell.
Good afternoon, everyone. Bon après-midi à tous. For the 9th consecutive day, it is my pleasure to tell you that we have no new cases of COVID-19 in New Brunswick. And many of you will see this as a cause for celebration. And from what I hear, some people are already celebrating. I heard that over the weekend, that there have been people out and about that perhaps may not have been socially distancing within their bubbles, but we'll talk about that later. Je suis heureuse d'annoncer pour le
For the 9th consecutive day, it is my pleasure to tell you that we have no new cases of COVID-19 in New Brunswick. Many of you will see this as a cause for celebration. And from what I hear, some are already celebrating by taking risks with their own and everyone else's health.
So let me be clear. We are nowhere near ready to declare victory over the COVID-19 virus. As heartening as it is to report no new cases, that is not how I define success. COVID-19 is still with us. It will be with us for a very long time, and we need to be able to accurately track its progress and contain outbreaks when they emerge. Until a vaccine or other treatment becomes widely available, this is what we need to be doing. And so at this stage, success is not just about not having new cases. Success is knowing how many cases we really have, how widespread the disease has become, and that we are able to manage it so that our healthcare system is not overwhelmed. To be able to do that, we have to continue to test individuals. And as of tomorrow, we'll probably be expanding our list. But as of today, we still have the list of if you have 2 out of the 5 following symptoms: fever above 39 degrees Celsius, persistent cough, sore throat, headache, and runny nose. It is really, really important for people to get tested. We can't accurately give information and recommendations around what measures to impose or release without the right information. So our testing levels have to remain as high as possible. So call 811 immediately and then follow the instructions that you're given if you have some of those symptoms.
If you or someone you know has any 2 of the following 5 symptoms, a fever above 38 degrees Celsius, a persistent cough, sore throat, headache, or runny nose, call 811 immediately and follow the instructions that you are given.
If there is any chance that you have contracted the virus, we need to know about it. And if testing confirms that you do have the virus, we need to know about it so that you can protect yourself and others. Denying or hiding your symptoms could have tragic consequences for your family and anyone who could come into contact with you. And I have heard in other jurisdictions that there is a problem with stigma, and some people are reluctant to come forward. So I don't want that to be a problem here in New Brunswick. I would like people to feel comfortable about presenting with their symptoms and getting tested. So we are now in the early stages of recovery from the first wave of COVID-19 pandemic. We don't have a lot of community transmission. Obviously, we have no cases right now, but there still could be virus circulating, and we are still concerned about the borders and travel-related cases of anybody coming in to the province. So anybody coming into this province must self-isolate for 14 days. That is how we will protect the population. This past weekend, I know that many of you enjoyed the activities in which restrictions have been lifted. And there have been many joyous reunions of parents have visited with children and grandchildren they have desperately missed over the last 6 weeks. But I know there has been sadness as well. The 2-household bubble doesn't stretch far enough to include every grandparent who is missing their grandchildren.
This past weekend, I know that many of you enjoyed the activities on which restrictions have been lifted. There have been many joyous reunions as parents have visited children and grandchildren they have so desperately missed. Someone sent me a video of a reunion between grandparents and grandchildren, and it was beautiful. I was really touched. And so people have been able to visit each other and to visit people they've been missing over the last 6 weeks. But I know that there has been sadness as well. Not everyone was able to see who they want. And I know that this led to some sadness. The two-family bubble doesn't stretch far enough to include every grandparent who's missing their grandchildren.
Among us, especially the frail and elderly, the anticipation of reuniting with family has to be weighed against the risk of inadvertently catching the virus. So again, we are still trying to protect people who are immune compromised, people who are older and have comorbid conditions and other health problems. So we really, really have to protect that population. The two-household bubble is a way to safely expand our contacts with others. So for instance, an elderly person who lives alone combining with another household to reduce that isolation. To be safe, this really has to be limited to 2 households only to reduce the number of close contacts that you have, because the virus is transmitted from person to person in very close contact. That's why we keep saying 2 meters of distance. So if you have your very close contacts in your household that you don't have to socially distance with or physically distance with, and one other household, you're expanding your close contacts, and those are the people that you need to stay in contact with exclusively. So it's only 2 households, not 2 households and another household. If we continue to see good results, this may be expanded in the weeks ahead. Le regroupement de 2
The two-family bubble is a way to safely expand our contacts with others. To be safe, this must be limited to 2 family units only. If we continue to see good results, this may be expanded in the weeks ahead.
à venir. I ask for your continued patience and adherence to public health advice. There was an article published recently, I think it was CBC or Telegraph Journal, I can't remember now, but they were talking about what our success depended on so far. And part of it had largely to do with the fact that the public was so cooperative and really listened to the public health advice and understood it. So that's what we need to continue to succeed. I am also aware that there are many instances where New Brunswickers have taken chances with the virus by holding multifamily gatherings and neighborhood get-togethers. That's really not okay at this stage. We need to understand the temptation to run these risks, but it's really important that the public, that everybody understands that it's just not worth it. We have been praised across the country for what we've done so far. And again, we really need the continued support and cooperation of the public to continue what we're doing. Given the incubation period of the virus, it may be a couple of weeks before we know if any harm has been done. Just like the Easter weekend, we were looking at the cases moving forward from that. And really, based on the data and the numbers, we have really only seen 2 spikes in numbers. One was right after March break, and then one was right after the borders were closed and they were encouraging people to come back into the country and into the province. So now, if we see a surge in cases, again, we have very clear triggers in place from a public health perspective to be able to go from one phase to another depending on the risks and the numbers. And so we really have to be conscious of that everything that we've achieved thus far is not guaranteed to move forward. We have to really stick with the program in terms of continuing to follow public health advice. And again, I need everybody in the population to be able to continue to do that for us to succeed collectively. Je comprends qu'il peut être tenant.
I understand the temptation to run these risks, but everyone needs to understand that it is just not worth it. Given the incubation period of the virus, it may be a couple of weeks before we know if any harm was done over this past weekend. But if we see a surge in cases, I will not hesitate to recommend that the restrictions lifted last Friday be reimposed.
All learning as we go. So be kind to yourself and to others as we get through this together. And I was really heartened to see there was a list of signs all along Regent Street with names of healthcare workers on the front lines that were being acknowledged. And I just think that's really wonderful to provide that support to frontline workers and other essential workers and all the people who are doing an enormous amount of work to keep us safe. Detecting and preventing the spread of COVID-19 requires the dedicated work of many dedicated health professionals. As we mark Medical Laboratory Week in Canada, I want to thank the medical laboratory technologists who are working so hard to quickly and accurately process tests so that we can continue to control the spread of the virus. Comme nous soulignons la semaine de laboratoire.
As we mark Medical Laboratory Week in Canada, I want to thank the medical laboratory technologists who are working so hard to quickly and accurately process tests so that we can continue to control the spread of this virus.
Tremendous, tremendous support from the laboratory teams around this province, and again, I just want to thank them so very much. It is for this reason that my advice remains the same. Stay home as much as you can. Maintain physical distance of 2 meters from others. Keep washing your hands and clean regularly touched surfaces and don't touch your face. In other words, keep doing what you're doing. We still have a long road ahead and we are traveling in the right direction. Thank you very much.
Good afternoon. Bonjour. On Friday, I was pleased to announce, along with the other party leaders in the All-Cabinet Committee of COVID-19, that New Brunswick was entering the early stages of recovery. We are slowly allowing people to participate in lower-risk activities while restricting high-risk activities. We are continuing to follow up on all reports received through our toll-free hotline about possible violations of rules. Actually, over the weekend, we received 758 calls, up from 617 calls during the previous weekend.
The calls we are receiving come from residents who have a range of questions and concerns. Since changes have been made Friday to the emergency order, we were not surprised to see an increase in the number of calls.
Law enforcement is following up on any reports we receive about potential violation of the rules. Peace officers are still focusing on educating the public whenever possible, but tickets are being issued when necessary. In the past week, 22 tickets were issued. A total of 77 tickets have been issued since the state of emergency was first put in place. Ticketing people is a last resort, but we will continue to do this when people break the rules. La plupart d'entre nous ont respecté.
Most of us have followed the rules up until now. I know that New Brunswickers will continue to make the necessary efforts as we are entering this first stage of recovery. We have given a lot of new information on Friday, and I would like to clarify some details about what we are now allowed to do and what is still not allowed.
I know there have been some questions about what we mean when we talk about a two-household bubble. Over the last several weeks, as we have worked to flatten the curve, you were all asked to stay within your household unit or bubble. Now, under our phased recovery plan, you are allowed to spend time with one other New Brunswick household. This doesn't mean every member in your family. This means one other household. Both households must mutually agree to only get together with one another. Les seuls rassemblements qui sont
The only gatherings that are allowed are get-togethers between the two households who have accepted to meet one another. You can still not take part in larger gatherings. And you cannot spend time with a person who is not a part of the household with which you have an agreement.
I know many people are excited about spending time with their loved ones. This is an opportunity to visit with a household that could include your parents or one of your siblings or even a close friend. I'm glad we're able to lessen the restrictions, but I want to remind everyone that this is not a free-for-all. If people start attending gatherings that extend beyond their two-household bubble right now, we could begin to see a resurgence of cases of COVID-19. Si nous sommes confrontés à cette situation,
If we end up being faced with this situation, we will have to reinstate restrictions that only allow people to spend time with those who live with them. I hope that this will not be the case and that everyone will follow the rules.
As Dr. Russell stated, we have, heard stories of household parties or family reunions, like all of a sudden, the gates are open. I wish to be very clear. We want to ease back into this new norm for New Brunswick. We cannot just let the rules all fall by the wayside and have a resurgence. Because of the strict compliance that so many New Brunswickers have followed, we are in a good position here in New Brunswick. And it would be a shame not to be able to continue down this path, reducing our numbers We have not had any fatalities to date, and we certainly want to keep it that way. We also announced the removal of several other restrictions on Friday. This included opening golf courses and driving ranges as long as physical distancing and safety measures are in place. Recreational fishing and hunting are now permitted. Driving on your ATV is permitted. The trails remain closed for now simply because we need to ensure that public gatherings are not considered. We must make sure that we follow these rules and we do not have an outbreak. And some of these activities foster the very nature of getting together in large groups. People can enjoy outdoor spaces, including beaches and parks, as long as they maintain 2 meters of space from other households. But playgrounds are not open. This includes those in municipal parks, provincial parks, schools, and all public playgrounds. The risk of transmission within this setting is just too high, and it's a risk that we should not take at this point in time. Co-workers and neighbors are allowed to carpool as long as they follow physical distancing by transporting the passenger in the back seat. Post-secondary students who require access to campus to fulfill their course requirements are now allowed to do so. This is a phased-in approach. Students will be able to go onto campus if their program requires it. Public health measures, including physical distancing and temperature checks, will be taken to protect students, faculty, and staff. As an alternative to online worship, religious organizations can now hold outdoor services as long as parishioners stay in their vehicles and park 2 meters apart. Je sais que nous sommes tous.
I know that we are all pleased that New Brunswick has made enough progress to allow us to start lifting some of the emergency order restrictions. But I also want to remind you that we need to be very careful still.
We have entered the early phase of recovery, but we must move slowly. Following the rules that are still in place is more important now than ever before. Team sports are not permitted. That means pickup basketball at the local outdoor court is a high-risk activity that is not permitted. Si les gens
If people do not follow public health guidelines or emergency order rules, we will have to reinstate restrictions.
If you are in a situation where you cannot maintain at least 2 meters of space from others, it is strongly recommended that you wear a face mask. We contemplated making non-medical masks when you can't physically distance mandatory at this phase. However, we recognize people need to acquire or make masks. In the next 2 to 4 weeks, it could become mandatory. We've received some questions from businesses, including construction companies, about masks. Again, we're recommending that people wear non-medical face masks, also referred to as community face masks. These type of masks are available in stores or online. You can also wear a homemade mask as long as it fits tightly against your face. As we move into different phases of recovery, wearing a mask may become mandatory when physical distancing or other physical barriers are not possible. Right now, we are slowly easing into the next phase of recovery. Let's make this a path that we won't have to regress or we won't have to return into more restrictive measures. I hope we'll be able to enjoy even fewer restrictions in the coming weeks. But that will only happen if we continue to do our part and follow the rules. I am so proud of New Brunswickers all across this province who have worked together. I'm so proud of my colleagues and have worked together in nonpartisan ways to ensure we focus on the right thing at the right time. And that right thing is our health care and the safety and well-being of the citizens of this province. Let's not lose focus. Let's ensure that we do what makes sense, common sense. We get questions every day, and they're questions that one would say, this just doesn't make sense. This is just not common sense. People will try many ways sometimes to find a loophole or some way to stretch the rules. We stretch the rules at the risk of infecting someone we love. Let's stay focused. Let's keep our strong record going. We can do this together. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Russell. Thank you, Premier Higgs and Dr. Russell. We will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Elizabeth Fraser, CBC.
Hi there, my question is for the Premier. We've been hearing from our audience about more Quebec cars in New Brunswick, especially in the north. Other than the pass system for Listic First Nation, has there been any relaxing of border enforcement on the Quebec border?
Absolutely not. We will be strengthening border crossing if anything. I've heard a number of very positive reports about the diligence that our safety and compliance officers have had at our borders, about questioning in detail about where people are going and their numbers and contact information, and then follow up. So if there's any information that would suggest otherwise, I certainly would like to know that. But there has been no relaxation of rules, and we will be continuing border operations in a diligent manner, very diligent manner, as one of our primary focuses to ensure that we protect our province.
Thank you, Premier. Monsieur Charles Cameron, TVA Edmundston.
Oui, ma question, merci.
Thank you. My question is for Dr. Jennifer Russell. This is phase 1 of the recovery plan that was announced last Friday. Once again, you mentioned wearing a mask in public and said that it was strongly recommended. There are still people who don't wear a facial mask in public still. Have you made models? Do you have a projection to know what's more efficient? What kind of percentage of people need to wear a mask to have the most efficiency at avoiding COVID-19 spread? Have you done any projection to figure out what percentage of people should wear a mask when out in public? I don't know if you understand the question. Answer: yes, I understand the question. We have not calculated a percentage. Our current recommendation is as follows. Our recommendation is for now to give the public enough time to buy or to make their own masks. It is possible that in the coming weeks it will become mandatory. And potentially also it will be extremely important in businesses and other, in shops, for instance. It will be mandatory. Physical distancing is still very important and will continue to be the case. It will be the case throughout this pandemic. We want people to maintain a 2-meter distance between themselves and others. In some situations, that will not be possible. It's important that we get used to wearing masks. Masks are not to protect yourself, they're to protect others. A lot of people have health issues, are immunocompromised, for instance. There's also elderly people, and we need to protect all of them. This is why we need to get used to the idea of wearing masks to protect others.
Dr. Fraser, merci, Monsieur Cameron. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. Premier Higgs, popular tourist destinations like St. Andrews wish to keep municipal parks and beaches closed to detract from visitors, but there still seems to be some confusion about what is and isn't open. Can you clarify if you were just speaking about provincial parks and beaches officially opening up, and if it's still up to each municipality to open up their own beaches and parks?
We are suggesting and saying across the province that all parks should be closed, both municipal and provincial. Our situation is one that if we don't follow these, we've had many requests from municipalities, and they have actually asked us what's our federal requirements. So basically suggesting, if we have a guideline provincially, then they would follow that, or they would be wanting to follow it. So we want consistency across here. So these parks and playgrounds are closed. There's nothing that would suggest otherwise at this point.
Thank you, Premier. Thank you, Ms. Hogarth. Andrew Watt, Telegraph Journal.
Bruce, maybe
Hold on,
let me
hold
come
on,
back.
Andrew.
I think maybe I was
Andrew,
confusing.
I jumped a bit here.
Yeah, no, that was me.
No, it was me. Vicky, the Premier has something to add.
Thank you.
Vicky, the reason I'm coming back here is because I think the distinction between parks and playgrounds. Playgrounds are closed. Parks are open. So anywhere where people can have an open space and walk around, that's fine. The parks, the playgrounds are concerned because of the actual issues around playground equipment and the concern that that can be a transmission source for kids handling the equipment. So there's a distinction there, and I wasn't making it. My apologies.
Thank you, Premier.
Do you mind if I just ask if, can a municipality, though, continue to keep its own parks closed if they choose to?
Vicky, we'll get back to you online through that. Andrew Watt, Telegraph Journal.
Thanks, Bruce. My question is to Dr. Russell. Dr. Russell, I'd like to know a little bit more about what happens in the nursing home where the rapid response team was deployed. Did the team have to exhume bodies to do tests on residents who'd passed away? And how many times has the rapid response team been deployed and to where?
No bodies were exhumed, so that didn't happen. And that was the only time that the rapid response team has been deployed thus far.
Thank you, Andrew, sorry. Michel Corriveau, Radio-Canada.
Oui, bonjour.
Hello, my question is for Dr. Russell. So you've mentioned it, there's been some confusion among the public about what's allowed and what isn't. And even since Friday, there's been some corrections on the government website that might have added to this confusion. Can we expect more details on your website about what is allowed and what isn't so that it's perfectly clear? There's now just been some confusion about parks and playgrounds. Answer, that is a good question. It's true that we've received a lot of questions. There was quite a bit of confusion. So right now we're doing everything we can to clarify all of this so that people have all the information they need and so that they can clearly understand what measures have changed and what it means for them. Now, on the question of parks and playgrounds with equipment are closed. Parks where you can go and have a walk are open.
Matthew Wacomo, l'Acadie Nouvelle.
Bonjour.
Hello, my question is for Dr. Russell. Is it possible that in the future we have to reinstate some rules at regional level, for instance, not for the entire province, but only in some regions? In which circumstances should we do something like that? Answer. That was discussed yesterday during a meeting with all chief medical officers in Canada. We have meetings 3 times a week. The guidelines we are receiving, so we are making decisions at national level and we decide what we want to implement in the province so that there's a certain consistency. And the guidelines are as follow. Each jurisdiction can implement their own guidelines based on the number of cases. It can be done at provincial or regional level. That is within our authority as a province.
Silas Brown, Global TV.
Hi, Premier. I'm wondering if there's going to be an increase in enforcement over the next couple of weeks with the slackening in some restrictions to ensure that we don't see things like you and Dr. Russell spoke about this weekend, where people are maybe going a little bit too far with the smaller taste of freedom that they've gotten with these new rules.
Well, the short answer, I guess, would be the diligence would continue. The focus areas that we've seen would be probably an area of priority. Looking for, large group assemblies that we've noted here that were not planned or sanctioned, nor condoned. And the risk is high, and so we will be heightening our surveillance. And as I said, fines will continue. We are at this point, and we do not want to regress.
Thank you, Mr. Brown. Geneviève Normand, Radio-Canada.
Oui, bonjour, ma question.
Hello, my question is for Dr. Russell. Looking at the national scale, New Brunswick is doing quite well. There are very few cases, very few active cases. What do you think is the reason for this result that is so good compared to the rest of Canada? Answer: I think many factors contributed to our success up until now. First off, we implemented measures very early to avoid further transmission when we had travel cases. Then there's also the work of public health and the government. There's the enforcement work that's been done. And also all of the teams that are working in different parts of the healthcare system. There's been a lot of communication. And another factor is the way that the members of the public took in the recommendation, the message, and made good decisions. I think that it's a range of factors that contributed to our current situation. I don't think it's one thing more than another. We're very lucky here, that is true, and we want to continue like this. We want to continue on this path with our next measures and protocols. We will maintain intensive collaboration in the weeks and months to come.
Sean Hatchard, Times and Transcript.
Thank you, Bruce. My question is for the Premier. Yesterday, news came out that a committee out of Moncton has submitted a bid to the NHL to host hockey games in the city if the league resumes its season this year. I'm wondering, does the province support that idea? Do you think it could work given the public health concerns and the current restrictions?
Well, first of all, although I commend the promoters for looking at ways to restart our economy, this is not the time to look at a mass public gathering like this. I think there's probably the odds of anything ever restarting in the NHL this season is very, very remote. And we've been very clear that looking to the year end, that we don't support the mass gatherings. A lot of the events have been canceled. So the last thing we'd be doing is trying to start one up at this phase, or certainly during these next several months, when our transition is critical and when we don't have a vaccine and when we're just starting to get our province moving in its new norm again. So I would say the odds are it's not going to happen.
Thank you, Premier. Thank you, Mr. Hatchard. Adil Ibrahim, CBC.
Thank you. This is a question for Premier Higgs. Snowmobilers and ATVers did go out on crown land and forest roads over the weekend. Why are they allowed to do that while the trails are closed?
Well, I think the point of the trails being officially closed is that people, are not taking a large group, and they're not taking and going to a cookout somewhere and having a major afternoon event. That's what we cannot have happen. The fact that, somebody's going to take their snowmobile or their ATV or take their motorcycle for a ride, and, it's reopening New Brunswick, but you need to respect the physical distancing. You need to make sure that we just do not get together at a gathering place like once happened or would normally happen. So we're not going to be chasing people down a trail. We're working with the ATV Federation. The snowmobile trails were closed many months ago, or several weeks ago, officially. So I'm just saying people need to be cognizant of what they're doing, use their common sense, and just avoid, meeting up in large groups and taking a risk of taking something home more than your snowmobile or your ATV.
Thank you, Premier. Thank you, Ms. Ibrahim. Lorien Cloteau, Radio-Canada.
Good afternoon. My question is for the Premier. I spoke with an expert who said that New Brunswick should be using the spare 500 tests daily to put in place what he calls a surveillance system and constantly test different parts of the population that's asymptomatic. So why doesn't the province run tests at its full capacity, which you have set at 1,000 per day?
So all provinces are in the same boat with respect to how they adjust their criteria to maintain testing. So as we try to keep our numbers of testing up, we change our criteria to allow for more people to be tested. We do have the capacity right now to go up to 1,000, and then in the weeks to come, we will be able to actually increase that to 2,000. And it is very important for people to continue to be tested, certainly those with symptoms. There will be probably situations in the future where we possibly would test asymptomatic people, but it would only be in very specific circumstances because the test really is a snapshot in time. And so again, you have to be clear on what the purpose is and why you would be testing those particular people. Certainly, again, we have also at the national level and other jurisdictions, we're all in the same boat as in terms of procuring equipment and making sure we have stockpiles on hand. And so that has also been taken into account when we're planning what we're doing moving forward. And certainly we have different options now for testing. So we have the regular testing that we're doing. We also have the Gene Expert machines that we can do the more rapid testing. So expanding our testing capabilities is really important as we move forward and making sure we continue to test the right people at the right time for the right reasons. And the number of tests will continue to be important because in order to maintain the accuracy of our data and to have confidence in that data to make decisions and base our decisions on that, we do have to maintain a minimum level of testing, and we would want to see that level of testing either stay the same or increase as things progress. So that's the direction we're headed.
Merci, Madame Croteau. Thank you, Doctor. Laura Brown, CTV.
Hi, Premier. I'm wondering, on Friday, we had seen and put out to the public, and the government of New Brunswick did as well, the graphics with the red, orange, yellow, green, and you've added the peach between the red and the orange over the weekend. And I think that was to specify that people cannot gather in groups of 10 or less, even physically distancing, despite that being in the orange category with the household bubbles. I wonder if you believe some of the complaints that came in over the weekend, or some people just didn't know, they thought that they could gather in groups of 10 or less while being physically distant because of this, the information that was put out on Friday.
I think that there certainly was a need for clarity in relation to what was put out Friday, because we got a lot of questions. So the graphics were changed Friday evening to very clearly indicate where we were making changes from our previous restrictions that were in red, so that we're moving through a transition into phase one. And it was very much to ensure that all we were doing was allowing a little more freedom, a little more ability for people to visit with a specific family member, and which meant they had to choose. The idea was, let's start easing our way back into our province under the new regulations and the guidelines of public health. But we had to be clear, so we had a number of questions. So I guess, we got the questions, we realized it wasn't clear, so we had to redo some of the graphics.
Thank you, Premier. Thank you, Ms. Brown. David Coach, Telegraph Journal, Times transcript.
Hi, the question is for Premier Higgs. So I've been talking to small businesses about this commercial rent subsidy program that was announced. Details of it were announced last Friday. People are welcoming the measures, but some are concerned that landlords are not going to opt in to the program. They will have to pitch in 25% or more of the rent payment. And one group representing small business owners says the provinces should make participation mandatory. Your comment on this, or any response to this?
Well, at this point, what we agreed to do was work with the federal government on the program that they had put forward. We have, I think, over 1,700 businesses that have connected through navigators and in our Opportunities New Brunswick portfolio to understand their specific needs. We will work with each business to understand their requirements, but at this stage, we're following the federal guidelines in relation to the rent subsidies, and we'll see what that looks like for all businesses. You know, what we're trying to do as a province is to measure how we can best utilize resources here in order to maximize the ability for businesses to get back up and running, and at the same time balance where we are so that they get up and running, they're sustainable for the long haul, and that we can get back to a normal. There's only so much activity, I guess, that any province can do, or one might say the federal government as well. So we just need to look at every case and do what's right by that business. And I know we can't be all things to everyone, but we'll do our best.
Thank you, Premier. Thank you, Mr. Coach. Adam Harris, Telegraph Journal.
Thanks, Bruce. Question for Premier Higgs. Premier, I was told today there were concerns from the seafood processing industry over the weekend as the province is still expressing concerns about accepting temporary foreign workers given just how few COVID cases remain in New Brunswick. To clarify, will New Brunswick still accept temporary foreign workers? And are you concerned that they could bring the virus into the province despite the rules in place?
Yes, I am concerned, and I really want to draw the distinction between temporary foreign workers and our immigration policy, because certainly we know long term we want to have more immigrants into our province, and that continues to be a focus as we get through this pandemic. But right today, we've put a lot of focus on our border security and not having movement in and out of our province. We have record numbers of unemployment. And a week ago, you know, I guess I made a comment about we need people to help us here with the processing plants. And then there's the added issue around the processing plants. And, you know, I've had these discussions with you know, my colleague in PEI. And because the concern is, you know, the warehouses are full and there isn't a market. The market is soft and it'll only get softer. And the projections are that if the plants start up, certainly the market will go lower. We will have, and I know the federal government is talking about building more storage or having more capability in storage. And really what would seem to make sense for this year is let's look at how we can compensate at least the spring fishery and say it may be best for all accounts where there isn't a market to have it delayed and not open the spring fishery. And so that would not only negate the need for temporary foreign workers at this time, but it would certainly minimize any risk of us bringing in the virus into our province, and it would also minimize the risk of what would appear to be only a delay. With the federal government delaying or offering all kinds of reasons why the process should start up into a market that essentially does not exist, we're only delaying the inevitable for the next maybe month or month and a half, and then we're going to be in a situation, well, how did we get here? You know, at this phase, it seems like it's coming. Let's just deal with it proactively rather than just try to move 1 week at a time. You know, I kind of like to think a little longer term than that.
Thank you, Premier. Thank you, Mr.
Temporary
Harris.
foreign workers still are coming. Can we turn them back?
Thank you, Mr. Harris. We're going to go to Colin McPhail with CBC.
Hi, I have a question. I'm hoping both Dr. Russell and Premier Higgs can respond to. We're looking for advice for people having trouble choosing their bubble family. So, Dr. Russell, from a public health perspective, what should people consider when selecting another household? And for the Premier, the government's guidance document says, in an effort to reduce social isolation. So does that mean you would encourage people to pick elderly relatives?
Well, this concept was borrowed from New Zealand, and in the messaging around their bubble concept, your immediate household is your bubble, and when you expand it to 2 households, the purpose of that is to minimize your number of contacts while decreasing isolation and all of the negative impacts that come with isolation. So obviously a person who lives alone would benefit the most from having that second household to bubble with, so then they wouldn't be suffering from all those negative effects of isolation. In terms of the elderly population, obviously, they are more at risk. So if you are bubbling with somebody who's elderly, obviously, you need to be very, very conscious of the fact that anybody who has health conditions, who's immunocompromised, who is older, and by older, it's actually quite young, 60, 65 or above, are at higher risk from having bad outcomes from COVID-19. So it's very important that when you do this, that you minimize, again, your contact outside of the house. Make sure you're not going out for non-essential things and you're not going out unnecessarily. So again, you're trying to minimize the risk of contracting COVID-19 and bringing it into the household, and then you're also trying to decrease the negative impacts of isolation.
Thank you. Did the Premier want to comment on that question? It was addressed to. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.